Hi, my brothers and sisters. My name is Lisabeth Crossman, Regional Psychiatrist from Western Regional Health Authority, Montego Bay, Jamaica. Let me start by expressing my gratitude to the Baptist World Alliance and in particular the organizing committee of this international conference. I'd like to also thank them for inviting me to present on this important topic. I also like to express my gratitude to the Western Regional Health Authority, in particular Department of Psychiatry, Cornwall Regional Hospital, for the support that they have lended in me being a part of this presentation. Okay, so we're going to be looking at mental health challenges, a silent epidemic affecting churches and communities. This is my presentation outline. We'll be looking at some definitions, the burden of mental disorders, the role of faith-based organization, some prevention strategies, and some best practice modules. When we speak about mental health, the World Health Organization defines mental health as a state of well-being. And we are saying that in the state of well-being, persons are able to recognize their own capabilities, can cope with the normal stresses of life, and can work productively and is able to positively contribute to the building of their communities. Looking at mental illness, it is defined as suffering, disability, or morbidity that is due to either mental, neurological, or substance use disorders. Of course, there will be the associated biopsychological makeup of individuals that can contribute to these disorders, and also adverse social conditions and environmental factors. And we call it the biopsychosocial, and we also add cultural factors that impact on these illnesses. So if we compare mental illness versus mental health, we're saying that mental illnesses would be thought about as mental and behavioral disorders, and they are alterations in your thinking, your mood, and your behavior, or there may be a combination. And what is very important is that the associated distress or the impact on how an individual functions. When we compare it with mental health, we're speaking about how aware is this person of themselves, how resilient they are in terms of bouncing back given their coping skills, and of course the positive contribution to society. When we look at an epidemic refers to an increase. It's often thought to be sudden in the number of cases of a disease above what is normally expected in that population, in that area. And if we continue on that trajectory and speak about a pandemic, we're speaking about the number of cases of diseases, not only in a specific population, but a global area. Why all the excitement? Why are we so concerned? Why? Because of when we look at the burden of mental disorders, we have to be concerned. It is very significant, it is growing, and it not only impacts on the individual's health, but it impacts on social issues, it impacts on our human rights and economics in all countries. When we look at how much of the global disease burden that it makes up, and when we speak about the global disease burden, we're speaking about a study that was done, a comprehensive observational epidemiological study looking at how the disease conditions contribute to mortality and morbidity, risk factors. And what we are saying is that 10% of this global disease burden would be attributed to these disorders. And if we look at the non-fatal disease burden, we're looking at 30%, and that is very high. So interestingly, originally it was thought that mental illnesses account for about 21.2% of years of life lived with a disability worldwide. But new estimates are showing that, listen, this is way less than really what is now thought to be. And it may account for up to 32.4% of the burden All right. The global burden of disease, therefore, showed that 5 of the top 10 contributors to years lived with a disability globally were mental disorders. So we have to pay attention. What we are seeing globally, 264 million people are affected by depression, 45 million people affected by bipolar disorder, 20 million people affected by schizophrenia, and 50 million people suffer from dementia. We are seeing a 13% rise in mental health conditions and substance use disorders in the last decade. And 1 in 9 persons living in post-conflict settings have a mental health condition. And of course, 2 of the most common mental health conditions, not seen mainly by psychiatrists, but mainly by our general practitioners or other doctors, are depression and anxiety. And it is costing annually the global economy $1 trillion. That's quite alarming. We have to wake up. We have to pay attention because we have to look at the burden on our children and adolescents. It is very heartrending because it affects children and adolescents very early in life. All mental disorders have issues, or most mental disorders, have issues very early in life. Their onset very early in life. And we are seeing that 1 in every 5 of the world's children and adolescents have a mental health conditions. Half of all disorders begin by age 14 years. And suicide is the second leading cause of death among 15 to 29 years old. Why is it that we have to pay attention? Because if it starts that early, the impact is going to be very significant on education, on work or occupation, their career focus, their relationships, and social and psychological well-being. We also know that early onset impairs individuals cognitively, and that in itself can be very significant. Suicide is really a big talking topic because about 800,000 die by suicide annually, 1 person committing suicide every 40 seconds. And when we look at what has happened in the last 45 years, the rates have increased over 60%, quite alarming. But what is even more alarming is that 80% of suicides occur in low and middle income countries. Countries that may not have the resources to deal with some of the conditions contributing to suicide. It's more of a pandemic, and we have to wake up and look at it. And what has caused it to bring it more into bear is the coronavirus and what it has done and how it has devastated most economies, how it has devastated household communities, and how it has caused a significant increase in mental health conditions because persons are now increasing their use of substances. Persons have become lonely because of the lockdown, because of being not able to communicate effectively with family members, not going out to interact with peers, or schools are shut down, or domestic violence, the wars, the sexual abuse is occurring. So we know that we have, in the next few years, a rise in the increase in our mental health conditions because of what has happened with the coronavirus. But how can faith-based organizations help? We have to pay attention. We have to look at the research. We have to do our own research. What is driving the epidemic or pandemic? And we have to look at these factors. Our social determinants of health, very important, because they speak about the conditions in which people are born, grow, live, work, and age. And if we look at what is happening and how these are affected, we can understand how these impact on mental health conditions. So how can the church positively impact communities? Through health promotion, and health promotion strategies are going to be based primarily on our social determinants of health, and of course, mental illness prevention strategies. And we say that we can lead multi-sectoral collaborations. We can recognize and create solutions for adverse conditions affecting health. We can enhance psychosocial well-being we can build resilient communities, and advocacy should be on the forefront of our agenda. So what are these social determinants of mental health challenges? Adverse childhood experience, a big talking topic, because if we cause abuse in children early, or anything that is going to prevent them from being socially well or psychologically well, will impact on adulthood. Discrimination or exclusion, exposure to violence, the increased use of substances at an early age, very important. We have to look at the legalization of marijuana and how it is impacting our children who will develop chronic mental conditions if they start using at an early age. The low educational attainment, job insecurity, unemployment, poverty, and neighborhood poverty all impact on mental health conditions. We continue with poor housing, no food available, poor access to transportation, poor access to healthcare, and of course how global climate change can impact our communities, our world in terms of pollution, adverse environmental conditions, and problems in our neighborhood. What is driving the epidemic or the pandemic? The suffering in silence. A lot of our community members, our brothers and sisters, do not really have a good understanding of what a mental illness or what mental illnesses are. Not only that, because they are not thought of as being medical conditions, they're thought of as being persons doing things to others, or in a cultural belief to saying that this is because they are not strong enough. Then persons refuse to speak about what is happening to them and they suffer in silence. What about our thoughts about mental illnesses or persons who are mentally ill? And when it affects us, we prefer to suffer in silence. But not only our thoughts, but our behaviors, how our policies are made, our programs are implemented, how we conduct our affairs in community. We discriminate against persons who are mentally ill, and so persons prefer to suffer in silence and face that discrimination or lack of resources, and possibly through discrimination. We do not have the services necessary to assist persons who are ill, and that will allow persons to suffer in silence. So these are things that can drive the pandemic and are driving the pandemic or epidemic. We need to remind persons that asking for help is not a sign of weakness. We have to look at how we can prevent mental illnesses and also the prevention strategies that can be driven by our faith-based organization. The first is the primary prevention, and what we do, we target all in community. So it's a targeting of all individuals, the anti-discrimination campaigns, the raising awareness of mental health issues, the creating of non-government organizations that are able to look at what are some of the social determinants of health that are not being optimized in our communities and how we can do that successfully. Mental health fairs, the early detection, screening, depression, anxiety, dementia, childhood illnesses. And these are things that most of our churches are engaged in, but we need to look more as to how we can do it better. So this is one example of raising awareness, something that we are on social media, we're on our WhatsApp pages. How can we raise the awareness through this media? We then look at secondary interventions, which are now targeted interventions, secondary prevention rather, targeted interventions. And these are like programs in community that will target children at risk, teen mothers, elderly persons, the substance use intervention, or women's crisis centers, or foster care, not only for children, but for elderly, or projects in terms of building skills, training, and agriculture, farms that can produce food that can alleviate and that can provide employment for some of our community members, or helplines that will offer crisis counseling that will engage persons and offer referrals so that persons recognize that there's support available and that persons are there to assist them. And then we have specific programs for persons living with mental illnesses. So support groups, the drop-in centers, the homeless shelters, the advocacy groups, the occupational therapy programs, and the vocational programs. These are all interventions that can be done in community and to help individuals living with mental illnesses. So once we have identified what is driving this pandemic or epidemic, once we have created our interventions and our programs, it means that we can think about learning from each other. We don't have to reinvent the wheel, but we can look at best practices, things that are happening in other areas of the world, within our own communities, in other churches, and we can collaborate. In Jamaica, there's a popular proverb which says, "One hand alone cannot clap." And I'm sure we're able to understand what that means. Let me share one best practice that I've looked at. And this has been publicized and spoken a lot about by our own consultant psychiatrist from Kingston, Jamaica, Dr. E. Anthony Allen. And he wrote up about the total healthcare model exemplified by the healing ministry at the Bethel Baptist Church in Kingston, Jamaica. And these are the features of the Bethel Healing Ministry: a total vision, salvation as wholeness, total person, whole person approach, total scope, promotive, preventive, curative, and rehabilitative, and also the total community involvement, where we have community-based activities looking at or targeting underserved communities, surrounding regions, congregation as healing communities, and of course the multi-level expertise, because the health facility now caters for all persons, providing psychologists, pharmacists, as they have a pharmacy, providing a medical doctor, providing a psychiatrist. What about the Sustainable Development Goals? We have to pay attention to those. We have to educate ourselves about those. And we have to look at them to see how we can intervene, how we can implement our programs aiming to look at these sustainable goals. And if we remember, the sustainable goals are a blueprint, and these are designed to achieve a better and more sustainable future for all individuals. So if we are going to work together, it means that the collaboration needs to happen so that we are able to achieve these sustainable goals by 2030, not a long time to go. Let me thank you and just remind you that as God's children and agents of positive change, we can make an impact for Christ. We can, by changing our circumstances, that will be effective in enhancing mental health of our brothers and sisters in community and the world. Let me leave by just reflecting on one of my favorite Brazilian authors. The world is changed by your example, not by your opinion. And to remind us, there is no health without mental health. These are my references, and I thank you once again. I look forward to the question and answer period so that we can talk some more and we will be able to have more fruitful discussions. I thank you very much for being with me. Thank you.